My name is Kate Birch, and this is my skill demo of administering and preparing injections. So the first thing I'm going to do is I'm going to look at my MAR. I can tell that the provider ordered an influenza vaccine and a tuberculosis test for Amy Brown. So I'm going to go introduce myself to Amy Brown right now. So knock knock. Hi Amy, how are you? Well, I'm glad to see you're doing well. My name's Kate. I'm a nursing student. I'm going to be administering your injections today, okay? All right, Amy, according to my MAR, it says you have no allergies. Is that correct? Perfect. And Amy, before we get going, can I get your name and date of birth? Okay, so her name and date of birth matches up with her patient wristband. All right, Amy, so the provider ordered an insulin shot and a tuberculosis test. Do you have any preference on which arm I put the shot into? You don't have a preference? Well, I'm going to put it on your dominant arm then, which is, okay, it's your right. Perfect. We're going to do your right arm. And that's going to go right up here, Amy. You might be a little sore for the next few days from that shot, okay? For the next test we're going to do is a tuberculosis test, and I'm going to put a little bubble under your skin in your forearm, and I need you to come back within 72 or 48 hours, 48 to 72 hours to have that test read by a nurse, okay? All right, do you have any questions? Have you ever had any reactions to an injection? And you said you have no allergies. All right, Amy, I'm gonna go prepare your medication, okay? So I'm gonna leave. Make sure the bed rails are up, patient's down, patient's comfortable. Okay, so when I prepare my injections, I'm gonna look at my MAR, and I'm going to make sure that my MAR matches up with all of the medication I've pulled. So I'm gonna look at my tuberculosis test first. That matches my MAR, that matches my patient, medicine, time, route. I'll do the proper documentation, and dose. Okay, so I'll check the dose when I pull it. And I'm gonna do the 6 rates for the influenza vaccine as well. I don't have to list them because I've already listed them. There's that. I have my needles prepared, my alcohol swabs, and I would wash my hands. Okay, and now for this video, I'm going to demo opening and preparing a glass ampule right now. So I'm going to take my 2x2, I'm going to check my glass ampule, I'm going to tap it to make sure all the liquid goes to the bottom. And all the liquid is now at the bottom. If I was using this for a patient, I would do the 6 rates according to the MAR, but I'm not. This is just for my demo, and it has not expired. Always check the expiration for everything you pull. So I'm going to use my 2x2, and I'm going to break the glass neck away from me. And then I'm going to put this in the sharps container. So since this is a glass ampule, I'm going to need a filtered needle to filter in case any glass was pulled. So I'm going to open it this way, touching the plunger. I'm going to remove the syringe because I'll use that, or not the syringe, the needle, I'll use that later. So I'm going to open my filter needle, put it on the syringe, open it, and draw. And I might have to kind of angle it to get every last drop. Okay, so now this is empty. I'm going to dispose of this in the sharps container. I'm going to push up the air bubbles. Okay, the air bubbles are up. Push out all the extra air, which I got quite a bit of air. Okay. Now I'm going to use the scoop method to recap my needle. And then I would change out my needle. I would put this in the sharps. Because you don't want to use a filtered needle on a patient. There could be bits of glass in that. That's the whole purpose of the filter. Move the safety out of the way, remove the cap, air bubbles are up, prime the needle. And that is how I would prepare a glass ampule. When I'm done, always put the safety on and it goes into the sharps container. Let's put it in the sharps. Okay, so for my next, now I'm back to my patient. I am going to now prepare my influenza vaccine. So the first thing I'm gonna do is I've already checked. I've made sure that this is the correct medication, not expired, and for my patient, I can toss the tops. I'm gonna clean the top because I wanna keep this procedure as clean as possible. So 10 to 15 seconds circular motion till it is completely dried. Okay, then I can toss these. Okay, so according to my MAR, it says 5 mils, but for this demo, we're gonna do 3. So, tops are clean. Open this. Move the safety out of the way. Whenever I open a cap, if I'm near a patient, I would turn my back to the patient and open like this, away from the patient. Okay, so first I'm going to inject 3 mils of air into the airspace of the liquid to create a vacuum and put some pressure in it. Into the airspace. Then I'm going to turn it upside down and let it fill. Okay. So right now I have 3 mils of liquid. And I would do whatever my company policy or procedure is for this, if it's to save it or toss it. Get the air bubbles out. I don't really have to prime it, but I'm gonna get all that air out of here. Okay, now I'm gonna inject my 3 mils into the powder, which I've cleaned the top of the powder, so that's okay. Inject it. Okay, so I'm not gonna put this down, and I'm just gonna slowly rotate this, not shake it, not be really aggressive, but just kind of mix it till I can see all the powder is dissolved. There's no clumps, it's all a uniform color. It's good to go. So now I'm gonna inject 3 mils of air into this. Flip it upside down and just let it fill. I'm gonna keep my needle into the liquid as much as possible, which is really kind of tricky. Really tricky. Okay. Okay, so I dispose of this however the company wants me to take care of that. Get rid of the air bubbles. Air bubbles are up. Quite a bunch of airspace. Okay, I'm right at 3 mils, so that's perfect. And now I'm going to put the safety on this needle and dispose of this needle because it has been dulled from being punctured so many times with the rubber stopper that it would not be okay to put on my patient. So, okay, so now I'm going to prime this needle. Air bubbles are up. Prime the needle. Recap it using the scoop method. And label. So I would write my medication, dose, initials, date, and time. And then I'm going to put my label around the bottom half of the plunger. There's one that's prepped and ready to go. Okay. Now I'm going to prep my TB injection. So, oh, and for the record, I noticed that Amy was a muscular woman, so I used a 1.5 inch needle for her, okay? I noticed her body shape and size when I assessed her the first time when I was in her room. Okay, so now I'm gonna open up my TB, open it like this, just handling the back part. I'm going to take my alcohol swab, clean the top of the vial. Okay, I would let that dry completely. Move the safety out of the way. So I'm going to use 0.1 mils. So open like this. I'd pull the syringe back to 0.1 mils. Okay. I'm going to inject that much air into my bottle. And it didn't work very well, so I have to pull the syringe. Okay, so I have 0.1 milliliters of fluid. And I checked this with my MAR. It is the correct dose. It is the correct medication. Here it is. Okay, so I'm going to use the scoop method. Put the lid on that. Label it with the medication dose, initials, time, and date. Put on the back half of my syringe. Okay. So at this time, I would go and I would look at my patient, and I would take these with me. I'd go look at my patient, I would look for her acromion process, I would note where I'm going to inject the medication, I would say, okay, little poke, and then I would, you know, which I will show. So I'm going to put on gloves, because so I've looked at my patient, I figured out where I'm going to put the injection. I took a alcohol swab with me, and for the record, I cleaned my hands before I put on my gloves. Okay, so now I'm going to clean my patient's skin. And I've found where I'm going to inject. I'm going to clean the area very thoroughly. If this was a real patient, it would be at a comfortable height for me. And I would turn my back away from the patient. I would go, oh shoot. Before I went into my patient's room, I checked my medication. I have performed my 3 checks. I've checked it in the med room, I checked it before I went to her room and in her room. And I've gone through the 6 rights. So I've done 3 checks and 6 rights. This is the proper medication. I'm gonna open it away from my patient. And then, let's see. Okay, it's cleaned. This is kind of hard to do and show. But I would be about 2 inches away, put it in like a dart, If this happened in real life, that's what I would do in real life. That's how I'd fix it. I'd aspirate, and then I would inject. Very slowly. I'd hold it for a few seconds to make sure the medication was actually entered into the patient. I'd pull the needle, put the safety on the needle, and dispose of the needle. Clean it, hold it for a little bit until they can clot, and put a Band-Aid on it. I'd watch for any reactions, and I would make sure my patient was okay. Watch for signs of shock. Some people get a little squeamish. Okay, so I would write on my MAR, I would initial and sign and put the time and date that I've done the influenza vaccine. Okay, now I have my TB injection, which I'm going to do an ID, which means intradermal, under the skin. So I'd turn my back from the patient. I've cleaned her skin on the forearm. I've inspected the forearm. I'd pull, turn back to my patient using a 5 to 15 degree angle. I'd get just as close under the skin as I could get. I'd inject the solution. I have a bleb, so I did it correctly. Put the safety on, dispose of it, clean it, being really careful because you don't want that bleb to go away. I would mark my bleb with a skin marker, so then whoever notes the bleb when the patient comes back knows the size to look for a reaction. I would again inform my patient that they cannot leave town. They have to come back within 48 to 72 hours to have this TB test read. I would tell my patient that, you know, if they're a little sore and there's no allergies or anything, that they could take Tylenol for the pain, because they will be a little bit sore. Answer any questions as needed, document everything. I document my TB test right there when I'm in the patient's room. I would sign initial on my MAR that I did it. And that is how I would perform and prepare injections. Thank you.